Welcome. Have you ever heard of ischemic enteritis? It's a serious condition affecting the intestines, where blood flow is compromised, potentially leading to severe damage. In this video, we'll break down everything you need to know about ischemic enteritis, from its causes to its treatment. So, what exactly causes ischemic enteritis? The main culprit is reduced blood flow to the small intestine. This can happen due to several reasons. Arterial embolism, where a blood clot travels and blood is supplying the intestine, is a common cause. Thrombosis, where a clot forms within an artery in the intestine itself, can also restrict blood flow. Another cause is arterial stenosis, which is narrowing of the arteries, usually due to atherosclerosis, also known as hardening of the arteries, less frequently. Venous thrombosis, where a clot forms in a vein draining blood from the intestine, can lead to congestion and ischemia. Finally, non-occlusive mesenteric ischemia, or NOMIM, can occur when blood flow is reduced without a physical blockage. This can be triggered by low blood pressure, heart failure, certain medications, or severe dehydration. Now, let's dive into the pathophysiology, what actually happens in the body when blood flow is restricted. When the intestine doesn't get enough oxygen and nutrients due to reduced blood flow, cells start to become stressed and damaged. This leads to inflammation and can eventually cause cell death or necrosis. The intestinal lining becomes permeable, allowing bacteria and toxins to leak into the bloodstream, leading to systemic inflammation and potentially sepsis. If left untreated, the intestinal wall can perforate, causing peritonitis, a life-threatening infection of the abdominal cavity. Ischemic enteritis isn't extremely common, but it's not rare either. It tends to affect older adults more frequently, particularly those with underlying cardiovascular conditions like atherosclerosis, heart failure, or atrial fibrillation. People with a history of blood clots or those taking certain medications that increase the risk of blood clots are also at higher risk. The prevalence varies depending on geographic location and access to healthcare. The symptoms of ischemic enteritis can vary depending on the severity and location of the ischemia. Common symptoms include sudden and severe abdominal pain, often described as cramping or colicky. Patients may also experience nausea, vomiting, and diarrhea, which can sometimes be bloody. In severe cases, patients may develop fever, abdominal distension, and signs of shock, such as rapid heart rate and low blood pressure. It's important to remember that these symptoms can be vague and mimic other conditions, making diagnosis challenging. Diagnosing ischemic enteritis often involves a combination of clinical assessment, imaging studies, and laboratory tests. Doctors will take a detailed medical history and perform a physical examination. Blood tests can help identify signs of inflammation, infection, and organ damage. CT angiography is the most common imaging test used to visualize the mesenteric arteries and identify any blockages or narrowing. In some cases, a mesenteric angiogram, which involves injecting dye into the arteries and taking X-rays, may be performed. Colonoscopy or sigmoidoscopy can be used to directly visualize the intestinal lining, but these procedures carry a risk of perforation and are not always appropriate. Ischemic enteritis can be classified into different types based on the location and extent of the ischemia. Acute mesenteric ischemia is a sudden and severe blockage of blood flow to the small intestine. Chronic mesenteric ischemia is a gradual narrowing of the mesenteric arteries, leading to recurrent abdominal pain, particularly after eating, also known as intestinal angina. Colonic ischemia affects the large intestine rather than the small intestine. We also mentioned non-occlusive mesenteric ischemia, where there is reduced blood flow without a physical blockage. The classification of ischemic enteritis can help guide treatment decisions and predict prognosis. Treatment for ischemic enteritis depends on the severity and underlying cause. In acute cases, prompt intervention is crucial to restore blood flow and prevent further damage. This may involve surgery to remove the blockage or bypass the affected artery. Endovascular procedures, such as angioplasty and stenting, may also be used to open up narrowed arteries. In cases of non-occlusive mesenteric ischemia, treatment focuses on addressing the underlying cause, such as improving blood pressure or discontinuing medications that may be contributing to the problem. Antibiotics are often administered to prevent or treat infection. Nutritional support, such as intravenous fluids and feeding, is essential to allow the intestine to heal. Pain management is also an important aspect of treatment. While it's not always possible to prevent ischemic enteritis, there are steps you can take to reduce your risk. Managing underlying cardiovascular risk factors, such as high blood pressure, high cholesterol, and diabetes, is crucial. Quitting smoking and maintaining a healthy weight can also help improve cardiovascular health. Staying hydrated and avoiding medications that can increase the risk of blood clots are also important preventative measures. If you have a history of blood clots or cardiovascular disease, Talk to your doctor about appropriate preventative strategies. The prognosis for ischemic enteritis varies depending on the severity of the condition, the speed of diagnosis and treatment, and the patient's overall health. Early diagnosis and prompt treatment significantly improve the chances of survival and recovery. However, if left untreated, ischemic enteritis can lead to serious complications, such as intestinal perforation, sepsis, and death. Recent research is focused on developing better diagnostic tools, less invasive treatment options, and strategies to prevent ischemic enteritis in high-risk individuals. Researchers are also exploring the role of novel therapies, such as stem cell therapy and gene therapy, in promoting intestinal healing and regeneration after ischemic injury. We hope this video has provided you with a comprehensive overview of ischemic enteritis. Remember, if you experience any of the symptoms we've discussed, it's important to seek medical attention immediately.